My name is Dr. LaRose. I have been with Atlas Psychiatry for almost 5 years now, and prior to that I did 3 years of adult residency at LSU and 2 years of child and adolescent psychiatry fellowship also at LSU. So I've been practicing now for almost 10 years.
What is the typical workup for ADD?
So psychiatrists can diagnose ADD or ADHD on a psychiatric evaluation. Sometimes if patients have other conditions that can manifest like ADHD, we will refer to a psychologist to do psychological testing, which is just more data driven, a little bit more scientific, and can clarify the diagnosis.
What are the differences between anxiety and ADD?
So anxiety and ADD or ADHD can present very similarly in a lot of people. Usually when people say anxiety, they're talking about what we call generalized anxiety, which is worrying excessively, overthinking, overanalyzing. ADD or ADHD can cause a lot of anxiety because people are having trouble functioning in their daily life, and that produces a lot of stress. But usually that worry is mostly connected to whatever area of functioning that they're struggling with, as opposed to generalized anxiety, which can be focused on lots of different topics like catastrophic thinking, bad things happening to them, worries about relationships, the future, ruminating on the past, things like that.
Okay. What are some signs of ADD people should know about, and if they think they have the signs, what should they do?
So ADD or ADHD causes difficulty keeping attention for long periods of time. People with ADD are usually very easily distracted by things going on around them or by their thoughts. They have trouble with time management. They have trouble attending to details. If they have the hyperactive impulsive type, then they also will struggle with impulse control, struggle to stay seated for long periods of time, sit still, trouble relaxing and winding down, and they're generally fairly impatient. So these symptoms, in order for it to be a diagnosis, have to affect the person in more than one area of life. So school, work, personal life, social life. And once that is happening, then the person should see a medical or a mental health professional to get evaluated.
Perfect. Thank you.